to the storage media directly, and it is cosmetically more acceptable to the donor family. However, on the other hand, there is the cost of media involved. The technique is initially difficult, and also we need to have more instruments available. For corneascleral rim excisions, we carry an instrument drum set and an insulated box with ice bags for the tissue. The instruments include sterilized instrument tray, drapes and gowns, gloves, antibiotic drops, iodine drops, cotton buds, syringe, and a scleral shell. The instrument includes eye speculum, conjunctival and corneal scissors, forceps, muscle hooks, artery clamp, a template mark, and a number 11 blade. The process starts by taking consent from the donor family. After wearing protective wear and gloves, the eyes are examined first in torchlight to look for any gross deformities, and at the same time the exposed parts of the body is examined for any disease or high risk behavior signs. After examination, the eyelid and the skin around the eyes are cleaned with 10% povidone iodine, and the lid margins are cleaned using a cotton swab in iodine. Care is taken to clean both the upper and lower lid margins carefully. After the cleaning process is complete, now we move on to the aseptic part of the procedure, and the gloves are changed.
এবার আমরা কিন্তু স্টেরাইল পার্টে চলে গেছি পুরোটাই। স্টেরাইল বলতে এখানে তো জায়গাটা তো স্টেরাইল অ্যাসেপ্টিক।
Surgical drape, and this can be now used to keep the instrument as a clean zone. So the instruments are laid out on the drape. After applying the speculum, once again we clean the eyes thoroughly with normal saline, followed by installation of antibiotic eye drop. We have to remember that corneascleral button excision is not a sterile process, and we should try our best to achieve the highest level of asepsis possible. Once the eyes are clean, we move on to do a 360-degree conjunctival peritome. After the peritomy is completed, using the number 11 blade, the loose subconjunctival tissue is pushed back to expose the bare sclera. Now this is a 16mm steel refine. We use it to make a template mark which is used to outline the extent of the scleral excision. This step is very important. It ensures a regular round corneascleral button, and also that the rim size is adequate. After the mark is done, a partial thickness groove is made along this mark using a number 11 blade, and finally an entry into the eye is made. Now the instruments are changed, and we use a corneal scissors to cut the sclera along this groove mark. While cutting, gently lift the cut section with the forceps to avoid injury to the underlying uveal tissue. This prevents adhesion of excessive iris tissue to the corneoscleral button, and also any accidental injury to the uvea can sometimes cause bleeding. After the sclera is cut all around, the corneoscleral button is gently separated from the underlying iris. And then it is placed directly in a vial of storage media, either mercury Kaufman or cortisol. A plastic scleral shell is placed over the excised part. This serves two purposes. It prevents the expulsion of the intraocular contents, and also it gives some shape to the eye and helps in cosmesis. Once both the eyes have been completed, the drapes are removed. Finally, we draw 3 to 5 ml of blood from any accessible vein. And this is transferred to vacutainer for serological tests. All the instruments and disposables are packed and taken with the technicians for proper disposal in the hospital. And finally, before leaving, we pay our respects to the departed soul, whose eyes will now help two others enjoy the world. To conclude, the corneoscleral button excision technique is not so difficult. It reduces the death to preservation time. The endothelial contact with the toxic aqueous is less, so this potentially improves the tissue quality. And most importantly, it is cosmetically more acceptable to donor family and more people donate ready. Thank you for watching.